I'm Dr. John Scharffenberg, a medical physician, professor of nutrition at Loma University, Loma, California. Today, I want to talk to you about dementia. You know, these people who are at home and their minds don't function are a real problem because it takes so much care for them. Oftentimes, the caregiver dies before the patient dies. Now, 50% of the dementia is due to Alzheimer's disease. And of Alzheimer's disease, 40% is due to the vascular type. There's no cure or prevention for this, but we think it's possible, perhaps, to postpone getting it by 5 years. Since it's older people who get it, if you postpone it by 5 years, you really accomplish the problem, taking care of the problem. You reduce the risk by 1/2. So we think we can do that, particularly with the vascular type. The vascular type is caused by the same risk factors as heart disease, and we know what those are. We need to exercise. We need to avoid all that cholesterol, saturated fat diet, the meat and that sort of thing. You need to know that people who have diabetes have 4 times the risk of Alzheimer's disease. One study showed that if you exercise, you lower their risk of Alzheimer's disease by 15%. But if you had 4 exercises a day, you reduce the risk by 50%. So exercise is extremely good in trying to reduce the risk of getting Alzheimer's disease. We need to figure out how to at least postpone it 5 years, and that will cure half the problem.